Well, hello, San Diego. This is Dr. Ross Colt here. I am the medical director for Gary and Mary West Pace. And I just wanted to give you an idea as we head into the 1st of April, a sort of a snapshot on the State of the Union on Gary and Mary West Pace. It has been a long year for all of us as we've been going through this pandemic. And as we continue to provide care for these wonderful, fragile, vulnerable seniors in our community, I just wanted to let you know, sort of to feel the pulse on where we are as the vaccine now has started to roll out to our community, and the kind of services that we are providing here at Gary and Mary West Pace, and perhaps just a look forward, a forecast of the future, if you will, on the world after the pandemic. So here at our center in San Marcos, we have continued to provide clinical and rehabilitation visits throughout the pandemic. We've had to greatly shrink the number of people that we have coming to the center, but we've maintained our excellent medical care, our physical therapy, our occupational therapy. Some of our participants need to come in for, say, injections or just to be checked out because they have a medical need. So we have never stopped for one moment providing that excellent care to all of our participants. But the thing that has changed during the pandemic is we've not been able to do our socialization visits. Many of you are aware that one of the key parts of our PACE model of this program for all of inclusive care for the elderly is we have a beautiful facility here in San Marcos, 20,000 square feet, state of the art. It's a healing environment, it's a light environment, and we're very much looking forward to bringing our participants back en masse to our center when it is safe to do so, and that is the key thing. So when the pandemic struck in March, we stopped doing purely socialization visits at our day center, but we are hoping to sometime soon to be able to open that up on a safe basis, on a strategic basis. And let me just tell you a little bit about how that might look. As we look forward to the future, many of our participants have been vaccinated. In fact, I'm happy to say that of our participants that have asked for a vaccine, we have been able to vaccinate greater than 95% of those. And in fact, greater than 92% of those that have asked for a vaccine have been able to get both doses, and so would be considered fully vaccinated. The good thing about that is as we closely follow the CDC guidelines, given the fact that most of our participants are dually vaccinated and the staff that are here at the center are dually vaccinated, that means that we can then start bringing our participants back into the center for some of that socialization that is so important during this pandemic when we've all been struggling with social isolation. So as we forecast and look into the murky future, if you will, as we look into that crystal ball that is kind of cloudy, we are expecting that at the end of spring, we will be able to start bringing our participants into the center to spend time in our day room, to be able to have some socialization with other immunized participants, to be able to have a cup of coffee, to be able to enjoy a hot meal here at the center in a safe environment when we are following the CDC guidelines, doing the appropriate cleaning, maintaining that appropriate social distancing at 6 feet apart, but yet allowing our participants to engage in socialization that's really, in many cases, been missing over the past 9 to 12 months. The other thing I'm happy to share for you is that we have had the blessing of having our community pod site to provide vaccines for our community. So going even above and beyond our PACE participants, West Health has been running a community vaccination pod right here in the parking lot of Gary and Mary West Pace. And this has been very successful as we've been trying to bring the vaccine to the very people that need it the most, to our fragile and vulnerable senior citizens. We have had many days here where 100 participants, or I should say 100 senior citizens above and beyond the participants have been able to get the vaccination. I believe at last count, we had vaccinated nearly 2,000 different members of our community as we at West Health and Gary and Mary West Pace are striving to help our community be a safer place and helping our community to make its way out of the pandemic. Now, one thing I would say in the midst of all this good news, as we talk about people starting to come back to the center, I know that all of us are suffering from cabin fever, and many of us want to start traveling again. We want to start seeing family members. We want to start spending time with friends. And we are continuing to follow the CDC guidelines on their recommendations. So again, currently what they are saying is, if you are fully vaccinated, you generally are allowed to spend time with other folks that are fully vaccinated. If you are going to have an outdoor gathering at your house, for example, you can include a small number of family members or friends from say up to 3 households and be able to have with social distancing and some of the various guidelines that are a bit lengthy, too hard for me to go into all of them today, but you can start to have those gatherings. But I would implore you, though I know we're all suffering from cabin fever, please let us not become complacent. We do have to maintain our guards. And when you're out in a public setting, we need to continue wearing masks. We need to continue our social distancing. We need to keep up with simple things like hand washing that have been so instrumental in protecting us from the pandemic. Our science continues to evolve. We learn more new things every day. It's thought that, boy, the vaccine is continuing to be sort of the saving grace that will help pull us out of the pandemic. So I encourage those of you that have not yet been vaccinated, as of the 1st of April, all of our sites here in the San Diego community area will be open up to those 50 years old and greater. And then by the 15th of April, they will be open up to all people 16 and older to be able to receive the vaccine, assuming that there's adequate supply available. So I would definitely encourage everyone to go out and get vaccinated. This is our greatest weapon against the vaccine, in addition to continuing with the mask wearing when you're out in public, continuing with your social distancing. So with that, again, Gary and Mary West Pace continues to be alive and well. We never shut our clinic door fully, but we are looking forward to, at the end of spring, starting to expand the amount of our participants that can come back into the center. We will be continuing to do that safely. We will be doing that with both compassion and concern for our participants, and we will be continuing to follow the evolving CDC guidelines. So with that, I will wish you God bless. Please keep up your guards, continue to practice safe manners of being out in public. Please, again, I can't say it enough, continue to wear your mask for now. I know that we want to get out, we want to travel, we want to leave our homes. And there are ways to now do that safely if you've been vaccinated and the people that you are visiting are vaccinated. But please continue to keep up our guards. We will beat this pandemic together. So thank you for what you do. Thank you and God bless from Gary and Mary West Pace.